Fibroids are essentially benign lumps which appear from the muscle of the uterus or womb. The exact cause of fibroid is not known, but we know that they are commoner in certain communities or ethnic, certain ethnic communities. We know that fibroids depend on estrogen hormone to grow. They have estrogen receptors, but the exact cause of fibroids is not known. Fibroids can rarely turn cancerous. If you look at the literature, less than 1% chance of fibroids turning into cancer. Benign fibroids are called leiomyomas, and the ones which turn cancerous are either called leiomyosarcomas, or there are differentials which can occur. But this is a very rare situation. Most fibroids, majority of fibroids are benign lumps. It depends on where the fibroid is growing in relation to the cavity of the uterus. So if the fibroid is growing inside the cavity of the uterus, the most commonest symptom is heavy menstrual bleeding. When the fibroid is within the muscle or the body of the uterus, more often than not, women would have painful menstrual bleeding. And if the fibroid is growing outside the body of the uterus, i.e., if it's growing inside the belly, then it will cause pressure symptoms. Now, it depends on whether it's growing backwards and causing pressure on the bowel, in which case women would have bowel symptoms, or if it's in the front, then more often than not, women have bladder symptoms like going to the loo frequently or pressure feeling whilst going to the loo. The treatment of fibroids would essentially depend on the symptoms, so and the location of the fibroid. So not all fibroids are required to be treated. Some of them can be left alone. Also, it depends on what phase of the reproductive life a person is in. So if you're very young and you're trying to have children and fertility is an issue where fibroid is in the way of implantation, then the fibroid needs to be removed and treated. So if the fibroid is inside the cavity of the uterus, then the right correct method of removing the fibroid is via endoscopic procedure. We call it hysteroscopy. Hysteros is uterus, scopy is examination. We use an endoscope to examine the cavity of the uterus, and we can then remove the fibroid without any cuts. So there are no cuts on the tummy because the approach is via the vagina. Whereas if the fibroid is not indenting or not entering the cavity of the uterus, then we have to approach the fibroid via the abdominal cavity. In which case, it depends on the site of the fibroid, the number of fibroids, and the size of the fibroid, whether we do this as an open procedure by giving a cut on the tummy, or we do it by keyhole procedure via endoscope. So there are various ways the fibroids can be treated, but it depends on the location of the fibroids. There are some newer technologies to treat fibroids, such as focused ultrasound, but this is not widely available.